Hello everyone and welcome once again to the subsequent part of how to manage pneumonia in pregnancy. In first part we talked about how to manage a severe pneumonia, mild and moderate pneumonia in pregnancy in OPD as outpatient department, and in this section we'll be talking about how to treat a severe pneumonia in pregnancy. So let us start the case. A pregnant lady presents to the ER in a deteriorated manner, or she is at the ward and she deteriorated. So how would you recognize it? The patient has fever, patient have cough, patient have malaise and fatigue, tachypnea, tachycardia, and patient might have low GCS scales depending on the severity of the pneumonia. Patient on physical examination, you found dullness to percussion, decreased breath sounds, you did CBC, it showed leukocytosis, and CRP has been raised, chest X-ray lobar opacity has been shown in one or more lobes. Then how would you decide to admit this patient or treat as OPD? Is the score of curve 65. It tells you about the C for confusion, urea, respiratory rate, and BP, and age more than 65. If the points are more than 2 or 3, you need admission in the ward or in ICU depending on the patient presentation. So what will be our next step? Next step will be we will be managing this case as a severe pneumonia. So how would we treat such patients? Always have an approach of ABCDE. You must assess and secure the airway on the breathing. If the SpO2 is less than 94%, you should administer O2 therapy via nasal cannula 1 to 6 liter per minute. In circulation, you need to pass to large bore IV cannula, as this management is in ICU or in a non-ICU setting, depending on the patient condition, and you need to monitor the vitals of the patient. Then at the same time you need to send the labs like CBC, urea crat, serum electrolyte, CRP, RBS, procalcitonin, and we should ask for a portable chest X-ray because we are going to manage this patient in ER. So how would we manage this patient in ER or in ICU, in non-ICU settings? So the choice of selection of antibiotics depends. First of all, we need to treat empirically. Empiric antibiotic therapy are always used for community acquired pneumonia, and 5 days are sufficient. So the combination therapy has been selected for a non-ICU non-severe or an ICU or severe patient. So if the patient is not in ICU and he's not severe, still we need to manage it like this, and if the patient is in ICU and severe patient, still we need to manage the patient like this. How would we manage this patient? We need to give one of these antibiotics, and we have a choice of injection ampicillin sulbactam 1.5 to 3 gram IV QID, or we can give amoxicillin with sulbactam, we can give ceftriaxone, and we can give injection ceftriaxone with. In these choices we have to select one of the medication, but plus we need to give a combination therapy of azithromycin 500 mg IV OD. So you need to select any one of them safely, as these medications are safest choices in pregnancy. If the patient is not allergic to it, you need to monitor, you need to check for the allergic history, and then you need to give the patient these medication safely. So next, if the patient has a risk factor for Pseudomonas aeruginosa, so then how would you treat this patient? Mostly you give injection piperacillin tazobactam 4.5 gram IV QID, which is known as Tenzo. Then the safer other drugs, you can give injection meropenem 1 gram IV TDS every 8 hourly, or you can give injection cefepime 1 to 2 gram TDS every 8 hourly with you have to select one of the antibiotics in them with the combination therapy of azithromycin, as we have mentioned earlier. So these are the antibiotics which can be safely used in pregnancy. And then we need the supportive treatment for the patient, like we can give the patient injection or tablet paracetamol 500 mg TDS for fever, Rotadine. We need to have an adequate hydration, nutrition, and rest. And don't forget the DVT prophylaxis, as the patient is in the ICU setting, the patient is admitted, they have a higher chance of getting DVT, so we need to put them on injection enoxaparin, sodium 40 mg, subcut OD. And the duration of treatment is mostly 5 to 7 days, depending on the patient condition and clinical scenario. So this was a short case of how to manage severe pneumonia in pregnancy in ER and ICU setting and the ward. So I hope this lecture will give you a confidence to manage the patient and safely select the antibiotics. Thank you for listening. Please like and subscribe my channel.